Welcome to my YouTube channel Laxo. First of all, this is an educational video on hydroxychloroquine, and so the viewers are advised not to self-medicate. Hydroxychloroquine is a medication used to prevent and treat malaria. Other uses include treatment of rheumatoid arthritis and lupus. Hydroxychloroquine affects how the body's immune system works. It means when a person suffers from autoimmune system, the body attacks healthy cells, assuming there is sickness in the body. By taking this drug, autoimmune system improves, and so healthy cells are protected from attack. Hydroxychloroquine may interact with other medications the patient is taking. Hydroxychloroquine was approved for medical use in the United States in 1955. It is on the World Health Organization's list of essential medicines, the safest and the most effective medicines needed in a health system. In 2017, it was the 128th most commonly prescribed medication in the United States, with more than 5 million prescriptions. Centuries ago, the Incas in Peru dried and ground cinchona tree bark, then mixed the resulting fine powder with a liquid. In doing so, they produced a medicine used to lower fever, later called quinine. By World War II, researchers studied how to further develop quinine for anti-malarial treatment, eventually creating chloroquine. Among soldiers who were administered these drugs, those with rashes and arthritis noticed their symptoms improved, paving the way for this anti-malarial medication to also be prescribed to reduce swelling and joint pain. Chloroquine was invented in 1934. By 1955, a synthetic and less toxic version of this drug, hydroxychloroquine, had become more widely available. There are side effects to hydroxychloroquine. It can cause headache, dizziness, diarrhea, stomach cramps, and vomiting. Accidentally swallowing just a few tablets has become fatal in some children. It can worsen skin conditions such as psoriasis, can create vision problems, sometimes permanently, and can cause heart diseases. It is to be prescribed by doctor based on the condition of the patient as part of the risk-benefit equation for a drug, and to take appropriate measures to mitigate any risk. They know that some patients are at greater risk of developing side effects than others. Mild side effects may go away within a few days or a couple of weeks. Talk to a doctor if they are more severe or don't go away. Hydroxychloroquine has been used to treat COVID-19 patients in China and France in a small group of patients. Hydroxychloroquine was administered with antibiotic azithromycin. The results are not conclusive. US FDA has approved the use of hydroxychloroquine on corona patients. In laboratory tests, it has been shown to block the coronavirus from invading cells, which it must do to replicate and cause illness. Additionally, it was found that pneumonia improved in 25 of 31 patients who received hydroxychloroquine. The current research on the effect of hydroxychloroquine on COVID-19 will look into the aspects of doses of the drug that physicians can use as part of a patient's treatment. If the drug can lessen the chances of getting the infection, whether it shortens hospital stays, helps patients avoid intensive care or ventilators, and improves fatality rates, watching for side effects. Even if hydroxychloroquine turns out to be effective on COVID-19, one always wants to have another tool, especially against a virus, because we know they can develop resistance against a drug. Thank you for watching. If you are not subscribed to my channel, please subscribe.